Hi, my name is Michelle, and welcome back to my channel. If you are new here, please subscribe to make sure you get all the alerts for the video, and it will help me meet my goal to 1,000 subscribers. I'm going to talk to you about 10 self-care tips for nurses. I don't want to put everyone in one basket, but the people I know, we really hold off on things. We kind of know too much information, so sometimes we self-diagnose. We need to get to the doctor more. So, with that being said, number one is going to the eye doctor. You know you're wearing those glasses that you've had for like 3 or 4, 5, 6 years, and you have not had a eye appointment in forever. So make sure you're going to those eye appointments every year. You know that your prescription changes, and it can change. Luckily, mine hasn't changed in years. So make sure you're taking care of your eye health. All right. Number two, going to the dentist. They really want us to be at that dentist every 6 months, getting our cleanings, and then just getting an assessment on our teeth, getting those checkups. So let's make it to the dentist. Let's get those crowns on. Let's get those fillings in for those cavities because it's bigger than your teeth being white. And we all know this. So let's take better care of our teeth. Now, we've talked about the eyes, we've talked about our teeth. Within this head of ours, we need to focus on our mental health as well. We have taken a traumatic hit within the past 3 years with COVID. So focusing on your mental health, whatever that looks like, take care of yourself. Number four, our chest area. So we are talking about our heart and exercising, whatever that looks like for you, whatever you can tolerate. Definitely start exercising if you haven't. Just do a little bit at a time. Or if you are on a path towards exercising, or if you exercise on a normal basis, continue that. That is a great thing. Keep it up. And if you haven't started, start at a slow pace and just do what you can do. Definitely talk to your doctor about what you can do. If you have, any issues, of course, but let's start some movement. I use my Apple Watch for steps. It definitely keeps me accountable. That accountability with my Apple Watch and my steps, it really works. So I have made it down to our hands. Manicures are, in my opinion, considered self-care. We wash our hands so much, especially if you work in a hospital setting. And I wouldn't say just a hospital setting, in a lot of different kind of settings. You may be one of those nurses that have to wash your hands consistently throughout your shift, throughout the time that you're at work. So having that manicure is self-care, taking care of your nails, taking care of your hands. I know when I was working in a hospital, my skin became very dry, and I could really tell the difference from washing my hands a lot. So going to get that manicure, even if it's just a simple manicure. So let's take care of our hands. Number six, we've moved down to our feet. So taking care of your feet with the pedicure is self-care, in my opinion, as well. Increasing that circulation. And you can do these things at home. You can do a manicure at home. You can do a pedicure at home. You don't necessarily have to spend money for these. We need to take care of our feet as well. Number seven, an overall body massage. It costs money for a massage. However, how often you can get one, we all know that our muscles get tense. And overall, a body massage is just relaxing. Number eight, are you practicing good ergonomics? So now we're to the whole body. We talked about the whole body massage. Now we're talking about ergonomics. Please make sure you are using correct ergonomics. It doesn't matter if you work from home, are you slouched over, in that chair all day? If you're working where you have to lift patients, are you using the right ergonomics? Please be aware of that. I was a CNA for 4 years before I became a nurse. I ended up with like a back strain. I wasn't using the correct ergonomics, and that lasted for several years. And also, when I worked in the ICU, we had those very heavy patients. So just make sure you're taking care of yourself and you're aware of your ergonomics. Number nine, let's assess our own skin. Make sure everything's looking good. Let's keep ourselves moisturized. So let's take care of our skin. We know this. And number 10, so now we're done with our whole body. Where we're going to go. So we're going to physically take ourselves to wherever we want to for our favorite pastimes, whether that is walking around in Target, going to Walgreens because you enjoy the cosmetic section, anywhere, taking a walk. Take your whole body somewhere to where you enjoy your favorite pastime. Don't forget about that. If you want to sit down and read a book, you don't necessarily have to walk out the house. Just don't forget about that. I hope you have enjoyed my 10 self care tips, and I will see you in the next video. Make sure you subscribe.